had a bone density scan and I have osteopenia. What does that mean and what do I do about it? I'm Dr. Catherine Bowling, practicing family medicine physician in Baltimore, Maryland. Osteopenia on a bone density scan means that you do not have normal strength in your bones, but you don't meet the level of needing pharmacologic treatment for that problem. You're kind of in a gray area. You're not normal, but you're not so bad that you need medication. But there are things you can do to either stay stable and not lose bone density or increase and perhaps get back to a normal bone density for your age. So the things that we recommend for people who have osteopenia are, first, get adequate amounts of calcium. Adequate amounts of calcium for a postmenopausal woman is 1,200 milligrams of calcium per day from all sources, supplements and diet. Now, I'm going to tell you right now, your best bet is to get all that calcium from your diet. Sometimes that's hard. People don't like milk, or they can't eat milk products. They're lactose intolerant, whatever, and they're just not getting enough from their diet. In that case, you can supplement up to the 1,200 milligrams. But I'll give you an example. Me personally, I drink almond milk. Almond milk has almost 500 milligrams of calcium per cup. So if I drink 2 cups of almond milk a day, I can get 1,000 milligrams of calcium just from that. Now, if I have a little bit of cheese, then I'm up to that 1,200 milligrams daily. I don't need to take any supplementation. But if you don't get that amount in your diet, you can supplement. Just don't go over 1,200 milligrams total from diet and supplementation, because going over can cause calcium deposits to build up in the arteries of your heart, and it can also cause kidney stones, which nobody wants. So you have to be a little careful with supplementation. Don't go over, but with diet, you can eat pretty much as much calcium as you want. The second thing to do to make sure is getting enough vitamin D. You can ask your doctor to test you for vitamin D, and your vitamin D levels should be somewhere between 30 and 100. Now, I like to keep my patients on the lower end, 30 to 60, because that's where the studies show there's only benefit, no risk. So 30 to 60 is where I keep my patients, and here in Baltimore, I find that people who take about 2,000 international units of supplementation a day stay right in that normal range. Now, it's hard to get vitamin D because we have to get it from the sun normally. And in Baltimore, our sun is too far north of the equator to metabolize vitamin D efficiently. Plus, we have wintertime here where there's not a lot of sun and people bundle up. So for a few months anyways, longer this year, we're not really getting much sun exposure. Plus, people wear sunscreen, and that blocks a lot of vitamin D metabolism. In fact, even an SPF of 15 blocks most vitamin D metabolism. And there's not a lot of foods we can naturally get vitamin D from. Vitamin D is fortified in regular cow's milk, and it's found small amounts in egg yolks, but you'd have to drink like 18 gallons of milk a day and eat 2 dozen eggs a day to get normal vitamin D, so really nobody's going to do that. So in Baltimore, it's 2,000 international units a day. It might be more if you live in Canada, and it might be less if you live in Florida. Talk to your own doctor about how much you could take. The third thing you can do to increase bone density is weight-bearing exercise. And I've actually done a couple videos about weight-bearing exercise and the exercises that I think are good to do. Many times the doctor will say to you, walk. And this is a good weight-bearing exercise because you're bearing the weight of your body on your hips and your legs and your spine. But I'm going to say that I don't think walking is enough. I think you actually have to lift weights. And you don't have to lift heavy weights. You just have to do some weightlifting, especially in the upper body. In fact, I think weightlifting is the closest you can get to the fountain of youth, for men as well as women. So weight-bearing exercise, calcium, vitamin D, these are the things that either keep your bone density stable or help you come back into a normal range of bone density. You really don't want to get osteoporosis, which is the worst case scenario where you can get fractures from things like taking a deep breath, which nobody wants. So do these things to either stay stable or help bring your bone density into a normal range. I'm Dr. Catherine Bowling, family medicine practicing in Baltimore, Maryland, for a healthier, happier you.